Completely crazy conspiracy theories about the CDC. Fifth, Bill Gates and Ebola. When the Ebola crisis was gripping the world, the CDC was doing something that, on the surface, might look a little strange. They were trying to patent the virus. That's just the sort of thing that conspiracy theorists love, and they jumped on it. According to the conspiracy version of the story, the CDC was trying to patent the virus so that they alone held the cure. They would, of course, stand to make a fortune. They were partnering with some other government organizations to do it, including the National Institute of Health and the US Army Medical Research Institute of Infectious Diseases. They also got a $50 million donation from Bill Gates. Clearly, that was the tell-all. Conspiracy theorists said that there would be no reason that he would possibly give that kind of money without expecting to make a profit at the end of the day. Gates's statement said that he wanted vaccinations for every child living in the third world, and that seemed to indicate that he was working with the CDC to secure his profit. The explanation for the patent, which was real, was much less threatening and pretty much the complete opposite of what the conspiracy people were claiming. By holding the patent on the virus, they would, in turn, ensure that no pharmaceutical company would be able to hold a monopoly on information crucial to developing a vaccine. Specifically, they had developed a version of the virus that was safe to work with and filed for a patent based on that work. Fourth, H1N1 was a hoax. In 2009, headlines were blazing with the latest news on the H1N1 swine flu pandemic. The basics included prevention, why it was important to get your flu shot, and the consequences of not getting said flu shot. According to the conspiracy theorists, though, there wasn't anything actually special or more deadly about H1N1, it was just given a serious-sounding name and used as an excuse to make some backdoor deals to sell vaccines. The CDC and the WHO were supposedly in cahoots in order to drive mass panic through the roof and to sell as many vaccines as they could. They targeted pregnant women and children, saying that those were the most vulnerable to the deadly swine flu, which, before it was over, had the potential to send nearly 2 million people to the hospital. Studies buried by the CDC apparently confirmed that it wasn't that bad at all. Family members only had about a 10% chance of catching swine flu from another family member, and 99.9% of those who contracted the virus would suffer no more than the effects of a mild, typical, seasonal flu. The CDC was accused of increasing the numbers of people who died from H1N1 and covering up other, underlying conditions or other medical reasons why people were becoming ill and dying. Blaming the flu for deaths meant selling vaccines, whereas telling the truth, including the idea that the flu was worse for people who were overweight, didn't sell as many vaccines. Some went so far as to say that the swine flu was less dangerous than the usual seasonal flu and accused the CDC of falsifying numbers and data to make the whole thing look way worse than it actually was. Also, they could sell vaccines that weren't going to work anyway. Third, Ebola, disease and immigration. The CDC is reportedly a major player in the establishment of the New World Order, and they're doing it by allowing illegal immigrants into the country to spread disease in the hopes of making the whole healthcare system collapse. Maps showing cities in which there were reports of Ebola were found to correspond with maps detailing the highest populations and locations of illegal immigrants. Those are the same locations that have been supposedly predicted to develop the highest density populations over the next few decades. These areas include those around New York City, San Francisco, and the Gulf Coast, among others. One of those other areas is Denver, which is home to the New World Order's official airport. How do we know this? Because of the massive, underground city and complex that's already been built under the airport in preparation for the establishment of the New World Order. Going along with the establishment of the New World Order is immigration reform. The CDC is accused of adjusting their Ebola screening protocols in order to hide an increased likelihood that immigrants coming from certain areas of the world are more likely to have been in contact with Ebola and other diseases. This is said to have a dual benefit for the CDC. The number of Ebola cases will grow, making the CDC even more crucial to the survival of the nation. It will also reduce the chances that nationality status will be linked in any negative way to contagion and the spread of disease, allowing nationals to enter the country below the radar and be sent off to the so-called New World Order mega-regions. It's not just Ebola, either. Conspiracy theorists are citing the presence of illegal immigrants allowed into the country carrying diseases such as tuberculosis, dengue fever, malaria, measles, and hepatitis. The CDC is said to be looking the other way while this flood of immigrants comes across the southern border of the United States, hoping to unleash many diseases into the country, causing the collapse of the economy and of the healthcare system, all helping to kickstart the New World Order. Second, Lyme disease. There are a ton of conspiracy theories out there on Lyme disease for a good reason. There's a lot that we simply don't know about it. We just discovered that there's a good chance that it's sexually transmittable, and that's a bit of the puzzle which only showed up in 2014. There's also a huge debate about whether or not chronic Lyme disease is a thing, which we've mentioned. That debate has very quickly risen to conspiracy theory levels, thanks in large part to Mitt Romney and Virginia Governor Bob McDonnell. According to their beliefs, and the findings of a task force led by the Chancellor of Patrick Henry College, the CDC has been misrepresenting the facts and numbers behind Lyme disease. The task force also makes some pretty dangerous statements, saying that the CDC, among other medical organizations, has no scientific proof that Lyme disease can be cured by a month-long round of antibiotics. The task force has also called for the CDC to stand down when it comes to investigating chronic Lyme disease, estimating that 1 in every 6 people in Virginia are infected. That's a far cry from the CDC's reports of 756 cases in all of 2011, and the belief in chronic Lyme disease is where the danger comes in. Because the symptoms are pretty vague in their own right: headaches, sadness, and fatigue. That means that it's not unheard of for people to be diagnosed with chronic Lyme disease when they're suffering from something else like depression, and it's keeping them from getting the help that they need. First, miscarriages and the flu vaccine. If there's anything that the CDC most often seems to get blamed for, it's getting in on the vaccine market no matter what the cost. In the case of flu vaccines, that cost was said to be unthinkably high. The CDC usually recommends seasonal flu vaccinations for the most vulnerable citizens, the elderly, the very young, and the pregnant. According to the National Coalition of Organized Women, the 2009-10 flu season was overseen by the CDC, which completely and absolutely did not care that their vaccines were causing thousands and thousands of miscarriages. They claim a 4,250% increase in the number of fetal deaths. Their information comes from the AWAS database, which, as we've said, isn't at all reliable. According to the accusations, the CDC knowingly put out a vaccine that hadn't been tested for reactions in pregnant women and then released information on how those same pregnant women were the ones that needed to make sure they got the vaccine. The doctor responsible for reporting incidents in those that were vaccinated, Dr. Marie McCormick, was targeted as having covered up the huge increase in fetal deaths. Thanks for watching.